The following is a pecha kucha, or chit-chat, regarding falls in the older adult population. A fall is an event in which a person comes to rest on the ground or lower level without the loss of consciousness. Excluded from falls are major intrinsic events, such as strokes, seizures, and syncope, or overwhelming environmental hazards. The probability of falling in 1 year for a person aged 65 years or older is 27%. Screening for and evaluation of falls is recommended in clinical practice, but this is difficult because of time constraints, competing demands, and perceived lack of skills. The goals of fall assessment are to determine the circumstances of previous falls and identify risk factors known to be targets of effective interventions. Previous falls, balance impairments, and decreased muscle strength lead the list of risk factors for falling among community-dwelling older adults. The most common causes of falls are accidents and environmental causes, gait and balance disorders, or weakness, followed by dizziness, vertigo, and drop attacks. In clinical practice, dividing fall risk assessment into predisposing, or internal factors, and precipitating factors, or external circumstances, is helpful. Internal factors could be cataracts, orthostatic hypotension, or dysrhythmias. External circumstances could include obstructions on walking surfaces or loss of edgings on stairs from patterned carpets. Evaluation of medication use is important since psychoactive drugs, as well as 4 or more total medications, are associated with increased fall risk. Gait and balance disorders are the second most common cause of falls and therefore desire evaluation. Brief assessments such as the Get Up and Go test or 6-meter walk can be easily used to assess gait in clinical settings. The gaits referred to are not pictured on this slide. Taking more than 20 seconds to accomplish the 6-meter walk is a positive screen for fall risk. Balance can be checked with side-by-side and tandem stance, as well as the 5-second one-leg stand, which can predict further injurious falls. Watching your patient walk can uncover gait abnormalities such as wide or narrow-based gaits, reduced step length or height, and reduced arm swing. As demonstrated on these graphs for men or women, velocity of gait can help predict mortality. A 75-year-old female who walks at 1.6 meters per second may survive 20 years, compared to a woman walking at 0.6 meters per second who is predicted to live less than 10 years. Measuring gait velocity may help in clinical decision-making. Look at the soles of your patient's shoes to pick up on asymmetric wear, such as in this patient with mild right foot drop. Interventions to prevent falls include physical therapy and the use of assisted devices. Multiple meta-analyses of randomized trials conducted in various older populations find that general exercise, especially when including a balance component, reduces the risk of falls. Shoes can be considered assisted devices to help prevent falls, whereas improper footwear can lead to falls. A proper shoe has a low heel, board toe box, and a high fixed heel collar, as well as a large surface contact area. Single-pronged canes provide unilateral support and support 15 to 20% of the body weight. Canes are useful in patients with lower extremity peripheral neuropathies. Rolling walkers provide bilateral support and support more body weight than canes. Gait is slower with walkers than canes, and it is more difficult to use walkers on stairs and in smaller spaces. Screening for falls is recommended by the American and British Geriatric Societies. A positive screen is one of the following: 2 or more falls in the prior 12 months, person presenting with an acute fall, or difficulty with walking or balance. By performing fall assessments on patients with a history of falls or mobility problems and treating patients' risk factors, falls can be reduced by 30 to 40%. The sky is not falling, but your older patients may be. Ask them if they are falling and discover their risk factors. With targeted interventions, you can prevent future falls.